Hello, West Michigan. You're watching Alive and Well. I'm Lynda Balkema. We are at the Muskegon Fire Station, downtown Muskegon, and this is the medication disposal program. It's a wonderful program. We've been talking to a lot of great people on this. With me is Janelle Johnson, and Janelle Johnson works at the Muskegon Community Health Project. And tell me a little bit about your role there.
I work in the pharmaceutical access program, and we just try to get affordable access to medication.
Yeah, to help people low income. Janelle is actually with the AmeriCorps program. So can you tell me a little bit about AmeriCorps?
Sure. I'm an AmeriCorps Vista volunteer, and what we do is we sign up for a year of service to help fight poverty in the United States.
Thank you so much. And they, you know what? They work for a very little stipend every month. So when you see AmeriCorps workers or you hear about AmeriCorps Vista volunteers, buy them a cup of coffee, take them to lunch because they work hard. And you're here volunteering today on your day off.
Yes. It's an important cause, so we like to be here.
Yeah. So you help people that are low income and need to get access to their medications, get prescriptions, and they can't afford them. And aren't you working in Oceana County now?
Yes, we just expanded our office up into Oceana County, so there's another access point up there as well for people.
Okay, wonderful. Well, thank you so much, Janelle. I really appreciate it. We love your hard work at the Health Project.
Thank you.
Thank you. You've been a joy. With me now is Laura Fitzpatrick from the Muskegon Community Health Project. And Laura, you were one of the founding members of this program also, correct?
Yes, I was. It's a labor of love for us over at the Health Project.
Yeah, there from the beginning. Awesome. So tell me a little bit more about your initial process with this.
Well, I'm with the Coalition for a Drug-Free Muskegon, and one of the things we do is identify issues in community. We saw that several kids, we saw from surveys, several kids were trying prescription drugs that were not prescribed to them. And we also heard from our law enforcement partners that it was a safety issue, that people had drugs that were not being used, that were simply in their medicine cabinets, that their youth could come in and try. Kids are curious at this age, so we wanted to make sure that we reduce access to those drugs by getting them out of the homes. So that was a really important thing. I was also speaking with another member of the Health Project who worked on pharmacy access, Stevie Ryle. And then I've also been working with law enforcement for a number of years for the coalition activities on alcohol and other issues. And this just came into a natural fit. And the other thing is, Carrie Youthy with Lakeshore Health Network was doing some research for her pharmacist or for her doctors about how to get rid of all those samples and other things. So it came in at the perfect time. We started on a meeting on September of 2009, and we had our first event in February of 2010. So it was great, a culmination of all of our efforts.
It's always amazing to me just to see today. I mean, I've heard about this. I haven't been to one of these events in the past, and I'm here live today and seeing all of these cars pull through, and I mean, literally pounds. I don't know how many pounds in the past, if anybody has a number. But
well, interesting, Lynda, up until today, we had collected 4,800 pounds of medication, over 2 tons, and we expect to hit the 3-ton mark actually today.
Oh, I bet you will hit 3 tons of medications. Right. Amazing.
One of the real unique parts of our program is we count and categorize all of the drugs. The reason we do that is because ultimately we want to have source reduction. So it's important to tell folks who can have some kind of impact on that source what's going on. So whether it's physicians and saying, hey, we're getting 10% of our drugs are for prescription. No, 10% of them might be for cardiac issues. Another 10% might be for diabetes. Something's going on where people are not using those drugs. Maybe it's the initial prescribing practice. So and then they're controlled. Our pain medication. There's just way too much pain medication here at our collection event. So we have to talk to the doctors and the other folks about
overprescribing.
Well, maybe just a different approach. We don't want to ever tell a doctor what they can and cannot do, but we want to share the data and inform them so they can make better decisions. So
make some informed decisions about maybe it's just a matter of, I know some people, I've done this in the past myself, you go to the dentist and you have an extraction or something done, and they end up giving you some Vicodin. What is it called? Hydrocortisone? Yeah, the generic name for Vicodin that a lot of us aren't aware. And yeah, you take a couple and you're feeling fine, and so the rest end up in your medicine cabinet for quite a while, and they sat there. And yeah, the fact anybody could come over there. I mean, even if you store them safely, so grandkids don't get into them, that's a big fear. But anybody can come in your house and find these. They could get stolen. So this is a great way to get rid of that. But also, like you say, the practice of letting those dentists and doctors know that maybe just down the road prescribe 1 or 2 or, half of it, and then go back for more as needed.
Again, initial prescribing might be 7 days of a medication rather than the full 30. Because I know I'm like you, I don't like to take things after I don't need them. However, we want to make sure that people are working with their doctors to make sure they're getting what they need and in a timely manner, so they're going to get healthier. So this has been really exciting for all of us. And one of the events we have coming up is a physician education workshop. We're going to have a whole panel of folks coming in to talk about the impact of MAMDP and what we've done here in the last 2 years. So led by Lakeshore Health Network and Carrie Youthy, we're really going to start getting into that, informing our physicians. And also, they work very extensively with the health plans to make sure that they know that, hey, if you have a policy that says, oh, sure, we need to prescribe for, we need to have a 90-day supply and that's what we'll pay for, doctors sometimes have no choice. So if you're having these things where the reimbursements are getting done based on that policy, what choice does the doctor have? So we work simultaneously with the doctors, with the health plans, insurers, and the patients. It's really
you are Laura is so good. She is a policy person, and this is so good for me because it gives me a full picture of how important policy is. Laura does tremendous work with different policies, all kinds of programs, and this shows me firsthand why that's so important. Yeah. And because we think about policy, that's not it. What does that have to do? It has to do with everything.
Well, one of the things that we do, and I saw you taping, is that we count and categorize all of the pills. Again, a lot of times when you go to policymakers, you can tell a story, and that's great. But when you give them actual data, that's very powerful. And that's what we wanted to do, is say, this is not just a story, it is a story with some compelling data. So it's a combination of both, and it's how you move things.
Could you tell our viewers just a little bit more about Drug Free Coalition and apps? Yeah, it's a great program, and I think there might be some people out there interested in knowing more about that and maybe how they could participate.
Sure. The Coalition for a Drug-Free Muskegon has been around since 2005, and we have 7 different subcommittees, including tobacco, the No Smoke Coalition, Muskegon Alcohol Liability Initiative, Muskegon Ally, Youth Development Network. We have the MAMDP as one of our task force, and we have data and executive committee. But really, it is to do a number of things: reduce access to youth for drugs, to increase consequences for youth. There's a whole bunch of policy things in there too, but we have over 50 members, organizations that are members of this. We have 75 members. We work on a regular basis and we do good stuff. In addition to this event, we do a lot of education on alcohol issues. Right now, the Face the Book project is going on in all the schools, and so we're very excited about that. We do a lot of education, retailer education, alcohol. We do a lot of policy work with our local units of government and the county commission, and so it's what we're federally funded by the Office of National Drug Control Policy, and it's funny because this day is National DEA Take Back Day. I don't know if you heard about that.
No, I didn't. Yeah. Nobody has mentioned that.
Oh, okay. Well, our partners and our law enforcement partners in the coalition, I think this is very important. Plus, we have the National DEA Take Back Day. 2 days a year in October and April, we've identified as to go with our federal partners and getting this done. So there are thousands of law enforcement officials and prevention agency people out there doing this very thing today. And so we had donated boxers from the DEA, the local DEA office, and they will be destroying this medication tomorrow. So, and our law enforcement partners will be taking it to but it was a real nice sponsorship with the DEA, our local law enforcement, prevention, the hospital, the health project, and multiple other, and our retail.
The Muskegon Fire Department. I mean, yeah, we got to get the fire department, the Muskegon County Sheriff's Department. Talk about, we're great at collaborating in Muskegon County. We do a lot of collaboration.
We do a lot of collaboration in Muskegon County, and it's funny because when we decided about these events, we wanted to have safe venues where people were very comfortable going to, and the fire stations were we're one of the number one venues we picked. Plus, they're covered, sure. And then people can have. They usually have really good facilities. So we've settled on this year for two events. One at Norton Shores Fire Department as well as Muskegon Fire Department. In the past, though, we've done events at Fruitport, Eggleston, Dalton County, or Dalton, up in Whitehall. We had some events. So we were taking them all over the county. But Lynda, we decided if we're only going to do 2. That we do the
a little more centrally located.
Centrally here, but we also put disposal boxes. And I don't know if you've talked to anybody.
Yeah. Oh, we've heard a lot about those disposal boxes.
We have disposal boxes at the police stations and also with our retail pharmacies.
Yes, we have the uncontrolled substances go to the retail pharmacies. The controlled substances go to the local police stations. They all have these black metal boxes. It's tremendous. It's like a mailbox. It's anonymous. You can go in and drop it off. So get those, any street drugs, anything in your medicine chest, get those out of there and get them down at those. I want to thank you so much, Laura. This has been tremendous. It is. It's what a great day, and you'll get to see, I'm sure, a lot of footage on the amazing amount of pills that have been dropped off here today.
Lynda came in behind the camera. Thank you so much for coming and filming our group today.
One last thing I'd like to say, if people would like to get involved with your drug-free coalition, give us some contact information.
Well, you can call me at the Health Project. I'm Laura Fitzpatrick, 672-3201, or you can look us up on the web. We're at drugfreemuskegon.com. And we also, the medication disposal has the mamdp.com website as well. And they have a lot of contact information on that. So anyway, thank you so much.
I'm going to say one thing on a final note. Laura, tell me a little bit. You just got a great award for some policy work. I mean, this is important because she does so much policy work. And tell me the name of your award again.
Oh, it's the Michigan Health Policy Champions from the Michigan Department of Community Health and several. It was in honor of Public Health Week, so it's very important to, as local citizens, to get in and do some policy work, whether it's local, state, or at the federal level. We all have a voice, and it's very important to use it. So, thank you so much, Lynda. I appreciate it.
Thank you. Thank you.